Okay, we're back for our second segment of MedZed this morning. This is a segment that may surprise some folks because we're going to put a good emphasis here on oral health as part of the maternity universe here, which I think, judging by some folks' reactions I've spoken to, often gets overlooked as a key component of overall maternal health. But it's absolutely crucial, and we are fortunate indeed to have the presenter to explain why to us here this morning. CareOregon's very own Alexandra Alexa Jett is our oral health integration manager at the plan. Her Bachelor of Science degree is in dental hygiene from OHSU. She's had expanded practice with her dental hygienist license and clinical experience in both private practice and in the FQHC public health setting environments. She is fantastic and has a lot of good information to share about this subject. So please give your attention to Alexa Jett.
Good morning, everybody. It's wonderful to be here with you. And we will be talking about Two Bright Smiles. So Two Bright Smiles, maternity and oral health. One of our medical directors actually had twins, and so we decided at that point it should be Three Bright Smiles. But these are the segment learning objectives that my goal, that when we're done with this, you can look back and say, yes, we did. We discussed the importance of oral health during pregnancy, why this is important during pregnancy and not perhaps waiting till after. How prenatal dental care is actually viewed as an upstream approach to early childhood caries and addressing that chronic childhood disease. And then also describing some physical and oral health integration efforts for this particular population. And I understand we are currently in a unusual world and environment and setting. It's almost as if every day there's new changes coming our way and pivots that we need to address. And in my own personal and professional life, when I'm attending numerous virtual webinars and learning, I'll think, what is something actionable that is bite-sized that I can take back, because we are having to prioritize so much, and change fatigue, constant change fatigue is a real thing. So one of my goals with the sharing of integration efforts is there perhaps something, a light lift, depending on where you are in your practice, that would be a good takeaway. We're going to start with the whole idea about oral health is part of overall health. And somehow over time, the mouth was and exited the body. And what we're wanting to do is bring that mouth back into the body. And this isn't just for our physical health disciplines, but also what can dental providers do. So HPV. Human papillomavirus causes about 70% of oropharyngeal cancers here in the United States. There is an opportunity for dental with messaging, and in the state of Oregon, pretty soon we'll be able to provide vaccines. So that's one way of looking at the mouth and the rest of the body. Hormones produced by stress can cause gum disease, and I'll be very transparent. I've noticed myself over the past 7 months having more sensitive and bleeding gums, even as a hygienist, and as Paul mentioned, flossing. This is a natural occurrence, and I saw this very anecdotally when I was in my own practice with patients. A very important relationship between overall health and oral health is around diabetes. So patients with diabetes are more likely to have periodontal disease, gum disease, and there's this bidirectional relationship. Chronic periodontal disease can actually lower A1C control, and having appropriate dental care can improve A1C levels. So that's an area of focus. And for today, we are going to focus on maternity, so oral bacteria that could lead to preterm and low birth weight babies. So oral health during pregnancy, Two Bright Smiles. Two Bright Smiles is actually a program, a curriculum, or an initiative that we created here at CareOregon for our whole organization. And this is the basic takeaway around Two Bright Smiles. Good oral health is part of good overall health. We believe that all pregnant patients should have dental care during pregnancy. Also, dentistry is safe and important for healthy pregnancy. The importance of good oral hygiene, and that's not just for the pregnant patient, but also the developing baby. So these 3 points, I think most people can agree upon. And then we get to this one. And this one gets us to scratch our heads a little bit more. Dental navigation, or care coordination to dental, so that that's streamlined and efficient. And that has been an area where we've helped support our partners, because it's not always that easy to connect. And when we go through this, we'll talk about what a referral looks like. And I know even with my dental background, in the past 5 years at CareOregon, I've been in integrated teams with our physical health and behavioral health staff, and they've upskilled me a lot about, hey, Alexa, a referral is like a closed loop in our world, and we're not quite there yet. So we will talk about some other navigation and care coordination mechanisms that can help connect the patients to dental. In 2017, CareOregon launched a cross-regional maternity oral health initiative. And when I say CareOregon, I mean Jackson Care Connect, our Columbia Pacific CCO as well, and then the Tri-County Portland metro area. We are a health plan in 7 counties, and this was launched across the board. Everyone was on board with this, not just the plans, our plans, but also the other departments. So in our marketing communications team, they knew that this work was being developed. And in our analytics team, there were new data reportings being developed for this population. When we launched this organization-wide program, we realized we needed to build infrastructure to support our prenatal providers with key oral health messaging. So this Two Bright Smiles curriculum came out of this initiative. We had to build that from scratch. And it's based in evidence, and we constantly are reviewing the materials to make sure that it's up to date with the best messaging. We also needed to build the infrastructure to aid connecting the patient to dental, understanding that the Oregon Health Plan CCO structure and dental plan structure can be very confusing, regardless if you're a member or the general public, or maybe even if you work in one of the organizations. How does this fit in? How can we connect our patients to dental? And so we needed to create some infrastructure there. We really see this maternity oral health initiative as a collaboration with our perinatal providers in order to help patients understand the importance of oral health and the role it plays beyond just the adult's health, but also for the infants. As we're working in our different networks, we also need to address the support for dental providers. If we're asking our physical health partners to connect their pregnant patients to dental, we need to ensure that dental providers are providing appropriate access and services to the pregnant patients. Yes, you may hear of some dentists in your communities who tell your patients that they can't treat pregnant patients, or that certain services are not recommended. And we are working with the networks to update and upskill the dental network. But this is also another reason why it's great to have the support from you and your teams, so that patients can hear this from their primary care or perinatal providers that, yes, it's important to see the dentist. And this gives accurate information to the patients about their health. So we launched this in 2017. We had 2016 baseline data. We are a very data-driven organization if you've worked with us. And so we collect data each year on the number of CareOregon medical members across all of the regions who actually completed a dental visit prior to delivery. In 2019, 32.4% of our pregnant members had a dental visit prior to delivery. That was about 4 percentage points lower decrease from the year before. We will get into the dental plan benefit, but all Medicaid patients have a comprehensive dental plan. And we launched this a few years back, and we're not seeing numbers improving. So that's a sign to us that there's more work that we need to do. We still encounter that our members don't always understand or know how to access their dental benefits. We hear from the general public and community partners that they don't realize that there's a full dental plan for their Medicaid patients, and also the same from providers. So part of what the messaging is with Two Bright Smiles is, yes, we have dental, and yes, we want our patients, our members, to use them. So what's the evidence behind the impact of oral health care and our pregnant patients? There is studies over the past few decades that may be a bit controversial, but there are studies that link oral bacteria to preterm and low birth weight babies. And the key here is inflammation. If you've had any of my other presentations in person prior to COVID changing how we operate, I do this generally for our diabetes chronic conditions presentation. And I would say, okay, if you're in the room, raise your hand, show me the palm of your hand. And then I'll say, if you were to take your gum tissue and you lay it out, it covers the surface of the palm of your hand. If I have bleeding gums, if I have infection, a heavy bacteria load on my gum tissues, and it's like an open sore in the mouth and I'm bleeding and this vascular tissue is very fragile, we don't always see that. Yet if I had that same type of sore and it was on my arm or my hand and I walked into a clinic or an urgent care, I think that there's a different type of response. So we want to keep this in mind, that it's still an open sore if there's inflammation and gingivitis and periodontal disease in the mouth. And that inflammation is the link to the preterm and low birth weight babies. So keeping that in mind, there are also other studies that show that having your teeth cleaned, certain periodontal therapy, deep gum tissue cleaning procedures during pregnancy, that's actually associated with decreased incidence of spontaneous preterm birth. What I'd like to note is that these type of cleanings are actually covered by Oregon Health Plan basic dental package, the dental package. Next, let's take a look at some common dental conditions that your pregnant patients may have. Pregnancy gingivitis, which is inflammation of the gum tissue. It's quite common. Gingivitis in general is pretty common, and then if you're pregnant and you have the hormonal changes, this can show up rather quickly during pregnancy. It's part of the inflammatory process, and it's oral hygiene dependent, meaning that if you already have bacterial plaque in your mouth, you're at a higher incidence or there's a higher risk of having gingivitis. And some of our patients may not have had access to dental care previously, or if they did, maybe they didn't utilize their services, or perhaps they just haven't been shown how to take care of their teeth at home with oral hygiene tools and education. So that's something that we keep in mind as we look at this population as well as our membership. Pyogenic granuloma is a pregnancy tumor, and it can look a little bit nerve-wracking. It can look a little bit scary. It's actually benign growth of cells, and it doesn't hurt. However, depending on where it forms, the patient can bite down, and that can be very painful and it can bleed. So studies show that it's about 1% of pregnant patients that form these tumors, these pregnancy tumors. When I was giving this presentation to Virginia Garcia's embedded hygienist as part of their project, pilot project with their interdisciplinary team at the Women's Clinic, I stopped the presentation and I said, okay, you are seeing patients here that are pregnant. You serve this community. Do you actually really think it's 1% of your population that you're seeing? And she said, no way. It's a lot more common in certain populations. So while that is the 1% is a study, I would say that depending on the patients that you serve and you see, it might be more common. And again, this is dependent as well on oral hygiene and plaque and tartar that is already in the mouth. And then erosion and dental decay. So in the picture, you can see white chalky area of the tooth, and that's where the minerals are starting to leach out. So demineralization, and then the outer layer of the tooth becomes chalky and dry, and it can chip away. And then you see that inner layer, which is more of a yellowish brown color. And those would require usually fillings. And there's a higher risk with morning sickness, with vomiting, and the gastric acids in the mouth that a patient can start forming erosion. And then also, if you do have a dental decay already that's formed, that gastric acid can cause those cavities to grow in size pretty rapidly. So these are the most common conditions. The National Consensus Statement, this is a wonderful, I reference this actually quite a bit, and we do have a link to this. So if you haven't heard of this before, it's oral health care during pregnancy. There was a work group meeting, and this is from 2011, and I do have the website here. It's multidisciplinary. So this is going to focus more on oral health care during pregnancy for both physical health and dental providers. HRSA convened a work group in 2011, and I did say it's interdisciplinary, multidisciplinary, American College of Obstetricians, Gynecologists, ADA, the Dental Association, and then the National Maternal and Child Oral Health Resource Center. They came together to create this guidance for both prenatal care health professionals and dental professionals in order to support pregnant patients with the best oral health care possible. The National Consensus Statement actually has this guidance that the prenatal care health professionals may be the first in line for assessing, reinforcing, and referring. So assessing pregnant patients' oral health status, how to advise to your pregnant patients about oral health care, and then how to refer. And so I'd mentioned what, like referring, how are we going to talk about referring and navigation? So here again, I'm talking about how to provide support services, perhaps case management, to your pregnant patient. While the work group and the committee started in 2011, on the National Maternal Child Oral Health website, each year they do an update of activities. So in May, they launched the 2020 update, which there's pictures of here. And what this resource has is it breaks out each year some of the projects from across the nation. And some might be more dental focused, and many of them are also focused in the perinatal and primary care settings, and some are interdisciplinary. And I'll call out that in 2016, American Academy of Pediatrics launched their Bright Futures Toolkit for prenatal and then oral health through childhood. So let's shift gears now. So we've talked about the importance of oral health during pregnancy, and how does this affect early childhood caries, and what is early childhood caries, and why do we think that this is a upstream approach? So dental caries is actually a transmissible and preventable disease. I truly hope that you and your practices have not seen this before, these pictures of these children's teeth. And if you want to, in the chat box, you can let us know if yes, this is something that you do see, if you see children in your practice. And this is not necessary. We are not born with the bacteria that causes the chain reaction of dental decay. If you see the picture where you can see the bottom teeth, you can see the bottom teeth look from the photo like they are intact versus the top teeth that have severe dental decay. And if you can see in the picture as well, the bottom teeth have pooled saliva around them. And saliva actually aids as a natural buffer, a neutralizer of the mouth. And when we think about sippy cups and bottles, and when we even bite into sticky foods, it's those top front teeth that have the most interaction with the carbohydrate sugars versus the bottom teeth. And then the bottom teeth have the saliva from the salivary glands underneath the tongue protecting them. So this is early childhood caries. Early childhood, so we're referring to ages 0 to 3, and it is preventable. So when we're talking about an upstream approach, we're looking at lowering the bacterial transmission from the parent or the primary caregiver to the child. So how are we passing cariogenic bacteria, which Streptococcus mutans is the first bacteria that you need to have to start this chain. This is common loving behaviors, kissing, transmission of saliva through kissing on the mouth, sharing food. Kids sometimes will pick anything up off the ground and put it in their mouth and share it to each other. Siblings, family members sharing spoons. I'm going to step back. When I was in dental hygiene school, and I'll age myself, it was the late 1900s, and we talked about the transmission of bacteria from mother to child. as you can see, I don't even use the term mother anymore when I do these presentations, it's patient. So this is really now aging myself. And the thought was, if we as dental providers could educate our patients to not do any of these loving normal behaviors, kissing on the mouth, sharing food, sharing spoons, sharing straws. When a pacifier falls on the ground, how many parents pick it up, lick it off, and put it back in the child's mouth? So we were taught to say, you can't do that. First of all, that's not motivational interviewing, which could be a whole other subject around dental and motivational interviewing. 20 years later, after I graduated from dental hygiene school, I'm here talking about how this is still actually a chronic childhood disease. So knowing that that's how we addressed it, that didn't work. So we are going to be doing these loving behaviors. How can we lower the amount of bacteria in the primary caregiver or in the parent so that we can't transmiss it? So the American College of Obstetricians and Gynecologists, they also wrote this committee opinion, and that's what they're saying. Let's decrease that burden in the pregnant patient. Let's lower that amount of bacteria so that it can't necessarily be transmitted to the children, and so that you can't have that onset of colonization of the cariogenic bacteria in infants to result in those cavities. So this is where we're going. This is another reason why we would really like to have all pregnant patients receive dental care. Every few years in Oregon, there is what's called the SMILE survey. And it's calibrated hygienists go across the different counties looking at second and third graders' mouths, ages 6 to 9. And they're looking to see if they already have had a dental experience, a dental cavity. Is it untreated? Has it been filled? Has it been treated somehow? And what we're looking at from a health disparity lens is that children from lower income households have about twice the rate of rampant decay. Rampant decay is 7 or more teeth with cavities. So that's what we're seeing. And when I am presenting here from the Oregon Health Plan, from CareOregon's lens, socioeconomic status, that's Medicaid. So this is really the population in the community that I'm serving. We also see that Hispanic, Latinx, and Asian Pacific Islander children have higher rates of decay. So we're looking at this, how can we address different communities and how can we make sure that there's access for everyone? About half of these kids already had a cavity. Again, cavities are 100% preventable, so I just want to let that sink in. About half already had a cavity by age 6 to 9, yet it's a preventable disease. It is also, per the CDC, the most common chronic childhood disease in the United States. It's more common than asthma, and it leads to pain, tooth loss, and also there's other ways that it affects us. It can disrupt speech development and healthy eating and chewing habits. If your teeth hurt or if you had to have your teeth extracted at a young age, you just have lost perhaps some of that function. And then also the social aspect of it, growing up then with teeth that are missing, that can affect us as well. So according to the CDC, again, it's about over 51 million school hours are lost each year due to dental pain and then absences due to dental visits. Kindergarten readiness. So when we speak about kindergarten readiness, this is how it ties in, that we're seeing that children that have a poor oral health status about 3 more times likely to miss school as a result of the dental pain. And that when they were missing school because of dental pain, that affected their school performance. So we're drawing these conclusions that if we improve a child's oral health status, that could actually perhaps improve their educational performance as well. Specifically here in the state of Oregon, we're looking at kindergarten readiness metrics, and the state has their measures to address physical, oral, developmental, and social and emotional health. And in this past year, we have the prevention dental metric, which is actually beyond ages 0 to 5, it's ages 1 to 14, that the state has put a metric into place, a quality metric, and physical health, you have many more metrics than dental, and we're actually very excited that we have our metrics because it actually signifies the importance of oral health in populations. And so we do have one around preventive dental visits for children, and the state determined that yes, 0 to 5-year-old preventive dental visits are directly related to improving social and emotional health. So this all ties into social determinants of health. And how I want to frame this is really, what's the relationship between social emotional health, social determinants of health, oral health? We know that the data shows that poor oral health is related to poor school attendance. Poor school attendance can result in poor graduation rates, and then this is a cycle. So if we think about early education, and that early education matters for graduation success, and education success equals or leads to income success here in the United States, then what are the prevention factors that can happen to ensure that the child stays in school? So we're looking at how oral health contributes to that. It's part of the cycle. But I do want to note that not all people who have a social determinant of health risk necessarily have a need. So from our lens, we're looking at how can we be more proactive and not just reactive when it comes to social determinants of health and needs. And oral health is one area with prevention dental cleanings that we can be more proactive and use that as a proactive measure. All right. So I'd mentioned earlier too, I can build the case about the importance of oral health and dental care during pregnancy and the importance of oral health for children. And then, great, what can we do about that? And what is something that might be applicable to all different stages of readiness? Before integration, this has been the common scene where a patient shows up perhaps to a different setting and they have a tooth issue, and I don't know how to address a tooth issue perhaps. When I was in the dental setting, I'll be really transparent. I wanted to help my patients. However, I didn't always feel comfortable asking a question I couldn't answer. For instance, if I asked a patient about their A1C, if they had more questions about their diabetes or provider, I didn't necessarily know how to connect them to the correct person. And so this is where we want to start opening the doors of communication and breaking down those silos that have been keeping us separate and, in essence, also holding back a whole person healthcare. This may be an ultimate graphic, right? And not everybody is going to be at this place where you could have an embedded hygienist in your women's clinic. There's multiple factors that need to be in place in order to do that. That is a great goal to have. I do need to give that plug, to have on-site embedded services. However, where else can we start? Can there be common messaging? Behavioral health. Behavioral health, I wish that I had really understood more about behavioral health when I was in clinical practice. We have some partners that are part of our oral health integration projects. VG with the embedded hygienist is one. We have another partner where they have provided trauma-informed care for their dental clinics. I never had that. And when I think back to how I used to have a practice and then now what I've learned, there's so much value around trauma-informed care and addressing patients' anxiety. So for behavioral health, you may have a pregnant patient who really hates going to the dentist and is really scared, and then how is there a behavioral health component to help that patient be able to complete a dental visit? And one of our future state goals is we would love everyone to have a health home and to have alignment. And that is one area that we're working on as a health plan. And I know there's multiple health plans in multiple regions across the state. So where can we find some of these pieces of integration that could help in different settings and different types of clinics? So this is, again, from the national consensus statement, and this is where I'd like to start with some brief interventions around integration. So this is guidance that came from the consensus statement again, and it's for the prenatal care health professionals on assessing, advising, and then what they call refer, and I'm calling that navigation to dental. So an assessment, how can you have a question in your patient assessment, your questionnaire, that is high level and can still get the point across around oral health? So do you have swollen or bleeding gums? Do you have any teeth that are hurting you? Do you have any problems eating or chewing food? Do you have anything going on in your mouth? Have you had a dental visit since becoming pregnant? So some of our partners actually do have some questions built out in assessments already, and there are resources that I'll be sharing, toolkits where they show sample questions as well. And most often, I would say I see questions around, have you had a dental visit this year? And while I might have had a dental visit in January, but I became pregnant in March, we want the patient to have that visit during pregnancy. And the dental benefit covers that. There is no question about it. They can come back in and have their teeth cleaned, and that's the importance of it. This is the one sometimes can be the head scratcher, the clincher, like, do you need help finding a dentist? I don't necessarily know if everybody knows how to do this. My guess would be that we need to have perhaps some support for our partners in helping patients to find a dentist. As a standard of care, and that's equitable across your entire panel, I know that our partners will say, well, great, you guys made some navigation tools to dental for your OHP members, but I have members who might be uninsured, or I have members or I have patients who are uninsured, or patients who have commercial plans. So we can find ways to have messaging, so where you might have a navigation tool for your OHP member, your patient that has a commercial plan, it might be a different way to provide that resource. And we'll get into the details around that here in a little bit. But this is part of what we do at CareOregon. We provide technical assistance, is what we call it, to our provider network. So we also came up with some recommendations for the advise portion. We do recommend that pregnant patients complete that dental visit if they have not seen a dentist during their pregnancy, or if oral health problems were identified. So maybe, hopefully you'll have some patients that said, oh, actually I just saw my dentist last week and I have ongoing appointments scheduled with them. I do want to call out that a patient might say, yeah, I had a dental visit, but if that was for urgent care or emergency care, we'd like them to be established in their dental home with routine care, that comprehensive prevention type of services, and that they establish with their primary dental provider. Another recommendation that we have is to encourage the good oral hygiene habits and to associate that with other healthy habits when we're talking about perhaps tobacco cessation. And tobacco cessation, I know that there's a lot of other interventions that go on, perhaps around substance use disorder and MAT. I'll focus on tobacco cessation and nutrition because oral health messaging can be added into that. So oral health messaging doesn't need to be a separate list of talking points. It could be, when you quit smoking, that another added benefit is that can help your mouth to become healthier, because people still lose teeth to this day from smoking. The tooth itself might look sound without a cavity, without a carious lesion, but that the gum tissue and the bone around the tooth have broken down to tobacco use, and now the tooth is so loose it's mobile, and either it comes out on its own or it has to be extracted. So that again is preventable. Around nutrition and how drinking water, limiting sugary carbohydrate snacks between meals, or combining that directly after a meal, nutritional habits can also impact the teeth in the mouth. And then informing patients that dentistry is safe during pregnancy, and it's safe and recommended for both the patient and the developing baby. And yes, I can't reiterate this enough, that it is safe, dentistry is safe during all 3 trimesters. There are a lot of advances in dentistry over the last few decades. And the largest advancement, I would say, is the use of digital radiographs. So where the assessment would say refer, now we're talking about navigation to dental. So I'm first going to talk about this from the CareOregon lens. So this is a HealthShare ID card. It has the physical plan, you can see the dental plan, and then mental health and substance use plan is on the back of this card. All of the CCO ID cards will have the dental plan listed on it and their phone number. So this is one important tool. And also you can identify your patient's dental plan the same way, I think. And, you know, I'd probably need to work directly with you if you had questions. But when you check your patient's eligibility in the state portal, you can see what, or if you're in HealthShare, HealthShare's portal in PH Tech and SIM6. So there's different ways that you can find out what the patient's dental plan is if they're not available to provide that information. The dental benefit package, I have talked about this already a little bit. All ages, comprehensive care. This is a wonderful package. Cleanings, x-rays, deep cleanings for gum disease, fillings. There's a limitation, time limitation on dentures. However, dentures are covered. Limited crowns and root canals. Extractions, of course, are covered. We have urgent and specialty dental care. And just how the enhanced benefit package, the benefit package is enhanced, during pregnancy. For your physical health benefit package, the same as during the same goes for the dental benefit package. So patients may be eligible for more frequent dental cleanings, and then as well for certain restorations, if applicable, during pregnancy. So that is something that is overlooked quite often. And when we work with the dental network, I mentioned we do want to have access so that our patients can be seen during this time period. So when we had to build infrastructure to help connect patients to dental, we created a request for dental services electronic form in the CareOregon Connect provider portal. So this is a useful tool for any HealthShare of Oregon member, not just CareOregon Physical Health, but HealthShare member. As of 2020, CareOregon holds the dental benefit on behalf of HealthShare. So there's no PHI HIPAA breach. If you have a HealthShare member, you can enter their information into this Connect provider portal, and we will help connect the patient to dental. So this is for HealthShare, CareOregon Physical Health, any Jackson Care Connect and Columbia Pacific member. And using this portal, it relieves that burden off of the patient of having to try and figure out who's my dental plan, who do I call, maybe I need an interpreter. And it takes that burden off of the providers as well, and our community partners from having to do that work as well. If you can just use the portal, then we take that burden on. And it simplifies patient DCO navigation. I've been referring to our dental care organizations, our DCOs, as dental plans and dental plan partners, but that's what that is. It simplifies that navigation to dental. This is what it looks like. It's pretty basic. It's a PDF fillable form. It's in the provider portal where you can also do your authorizations, look up eligibility and claims. And it requires basic patient information and your clinic information. There is a radio button for urgent or non-urgent need, and then a radio button for if the patient actually is aware that you're submitting this on their behalf. And the reason why that we have that is when the dental plan does their outreach, that changes the messaging. If somebody doesn't know that their information's been put in the portal and they don't expect a dental plan to call them, that is more of like a cold call, outreach call. And we would change the messaging versus somebody who's expecting because their prenatal provider said, I'm going to put you here in the portal, your dental plan's going to reach out to you, I really want you to follow through with your dental care. So that helps us identify which type of outreach messaging to use. You can also do free text. You can check the boxes if there's any swelling, abscesses. And then for health conditions, it's not an asterisk where it's required to submit it, but we do ask if you know that the patient is pregnant or if they have diabetes or another medical condition that you mark that down. There's also an area for free texting. So if there's other considerations like, hey, the patient's very phobic. If you want to say something about interpretation needs, that's an excellent place to put that in as well. And when you press submit, it comes to us at CareOregon and it configures who the patient's dental plan is. So you don't even need to know that when you fill this out. We're trying to make this as efficient for our partners as possible. Our care coordinator receives this the next business day, and then outreaches to the dental plans, and they call the patient. They call the patient, they do the outreach, they do a letter if they can't get a hold of them, and their goal is to schedule them in dental, to identify, do they have other needs, like non-emergency medical transportation, which is a basic Oregon Health Plan benefit, interpretation services. Also, are there other family members or siblings or people in the household that could also benefit from using their dental benefit? They can schedule them. I said I'd have some bite-sized, hopefully, takeaways. So this doesn't look necessarily bite-sized, but let's talk a little bit more about what navigation to dental can look like. Let's say your clinic does not have dental. You are a medical clinic. You do not have dental sites in your network, in your system. This is some of the support that we give to our partners. So we would talk about, okay, could the medical provider do a referral, internal referral to your care coordinator? What would that look like? What would that specifically look like in your EHR? Is it going to be like an in-basket? Is it a warm handoff of some sort? If you are in our network and you can access the portal, then you could put the portal dental care request in. Maybe you have care coordinators. Maybe if it's your patients that have a commercial plan, some of our partners for their pediatric patients have done this. They find pediatric dentists in their neighborhood around their medical clinic, and they make a little half sheet, of one pager, and they say, you have a commercial plan. These are pediatric dentists here in the neighborhood. We want your child to see a dentist. They may or may not take your insurance plan. Feel free to call them. The reason why we don't advise for Oregon Health Plan members that you help connect them to a specific dentist is because each of the dental plans contracts with their own dental network. So if you have a favorite dentist down the street, they might not actually accept OHP. Or if they do, they might not accept that dental plan. Or if they do accept that dental plan, maybe they're closed to new members, to accepting more patients, and they don't have any access. And oftentimes our private practices, because they don't work in the CCO structure, then they don't know how to help the patient anymore other than, I'm sorry, maybe call OHP. And so we want to eliminate that, because that's become up as a barrier over the years, because then we hear from members that they didn't know where else to go, and so they didn't go anywhere. So that's why always referring or connecting the patient to the dental plan is the way to go. Now, let's say that you are a healthcare system where you actually do have a dental clinic, and there's some other ways that you could have this internal workflow. One would be perhaps to schedule an internal visit into your dental clinic. If your patient has a dental plan that your dental clinic doesn't accept, maybe that's where you put that into the portal dental care request. I do recommend that even if you are in our, I was going to say if you're not in our network, but even if you are in our network and you have questions around this, reach out to your health plan, reach out to your CCO and ask them, hey, I contract with you, I have patients, I want to connect them to dental. What is an easy mechanism? How can I do this? I know that they're dental plans that I should connect them to. What does that look like? So now we're going to get to some more of the fun of what integration and action really does look like. So we'll start here in the CareOregon metro region. Prenatal provider maternity list sharing. That's a mouthful. Due to OHP not always having the most up-to-date pregnancy status of enrollees, oftentimes we as the health plan don't even know that our members are pregnant until we receive a bundled claim for delivery. So if they've already delivered, we've missed out on a lot of opportunities for prevention visits. I'm talking beyond oral health. So to us, knowing who our pregnant patients are, that is gold. And it's not as easy as you would think to share this information. So maternity list sharing, we have a larger prenatal provider here in the area where we've set up a secure data transfer site through our IT department, and it's a monthly sharing of data, so they don't have to worry about HIPAA breach, PHI breach. It goes directly to us, no emails being needed to be sent. And with that information, it comes into a spreadsheet. Our care coordinator then identifies who the members are. The sheet will say which dental plan they have, and then the dental plan gets that information and they do the outreach. So this is one way of not having to worry when you have a larger volume of pregnant patients on how to get that information out. And you can still use the portal, especially if you have some more of an urgent need, because that would be a more immediate. We'd get that the next business day rather than the cadence that our partners have set up for a monthly sharing. And then also the embedded expanded practice dental hygienist in the women's clinic. This is more of a organizational wide initiative for Virginia Garcia, where dental hygiene services are provided on site. And the hygienist was part of the team, still is part of the team, and part of the women's clinic team and prenatal team, and attended huddles. So this is integration in a really true form, attended huddles, and then also learned how to support the team if she had downtime. And unfortunately, due to aerosol generating procedures in dental cleanings, and then also needing to have the 6-foot distance, and limitations in the clinic itself, they've stalled. I'll say stalled because it's going to pick up in some way, shape, or form again. But now we're looking at to pivot, our favorite word here during COVID. How do we pivot due to COVID? And so we're working with our partner about utilizing teledentistry and what services can be provided to the pregnant patient during their prenatal visit, so that they don't have to have one other visit at the dental clinic. What can we do ahead of time? So how can we possibly utilize teledentistry with having the hygienist on site with intraoral camera and a portable digital x-ray machine unit, and that the dentist is off-site and is able to take a look at the findings, do that exam, and do some diagnosing from that level, and to help expedite the patient being able to receive treatment and services, and prioritization of the population, especially with access being a concern during COVID. So this is one area that we're hoping to support our partners with during this time as well. Another area of integration and action in our Northern Oregon Coast region and Columbia Pacific, which is Tillamook, Columbia, and Clatsop counties, is they have a very innovative First Steps incentive program. So if any of you are participants of First Steps, a provider, please, you can put that in the chat as well, and I thank you for that. First Steps provides incentives for their members for completing prevention visits prior to delivery. And dental visits were added to that list. So that's excellent. And by completing these visits, the members can earn Amazon gift cards, and all before pregnancy. What another benefit of this too is then, again, here we're learning who our pregnant patients are, so we can provide even more outreach and support if necessary. For our partners down in Medford and Jackson Care Connect, Jackson Care Connect has the Starting Strong store, which Starting Strong is the program in their store, supports pregnant patients and children ages 0 to 4. Due to COVID, the store has been closed. So the traditional health workers, the care coordinators, the store coordinators who work there, they have developed a postpartum program. And this postpartum follow-up includes oral health messaging and navigation to dental. So again, the postpartum questionnaire has multiple questions. 2 are dental. Have you had a dental visit, and can I get you connected to your dental plan? And so they do the outreach. It doesn't have to be extensive. It doesn't have to be a heavy lift, but where are there opportunities for oral health to be included? And pregnancy and dentistry. So yes, dentistry is safe throughout all trimesters of pregnancy. It used to just be, oh, we'll just do urgent care or acute care and get you out of pain. And now we're saying, no, that bacterial load, we want to lower the bacterial load and lower that burden of bacteria to lower that transmission. So I feel like I say the same thing over again, let's lower that bacterial load through comprehensive care. So now dentists are providing, and hygienists, the prevention, all the prevention services, restorative services to lower that amount of bacteria, in the mouth. The dentists are up to speed with which local anesthetics are safe to use, and also antibiotics, prescriptions, appropriate prescribing methods, and very key too is how to position the pregnant patient in the dental chair to avoid pressure on the inferior vena cava. I have to do the plug for Two Bright Smiles. I am a CareOregonian, so this is from the initiative. This is what we created for patients. We offer our Two Bright Smiles brochures in Spanish and English, and here's an example of it. Those are drawings from 5-year-olds, children who were turning 5 the year that our CCOs were turning 5. So these are actually from children in Jackson Care Connect. I love the awesome carrot. We have these. Currently, they are printed. As our world has shifted and things are becoming more electronic and virtual, I will be looking into how we can create these as a virtual link perhaps for our partners who are interested in this. And then also we have an oral health slideshow. So if you have monitors or a TV in a reception or waiting area, we have a slideshow already built out that you could play on a loop that promotes oral health messaging. So no need to build something or recreate the wheel when we already have some resources for our partners. For our providers, we offer a 30-minute curriculum, our evidence-based curriculum, Two Bright Smiles. I mentioned technical assistance around workflows. What does this actually look like, right? We can help design that. How can you share the pregnancy lists? And then also part of that upstream approach, we do have 2 First Tooth trainers here at CareOregon where we provide support for the state's First Tooth program around early childhood caries prevention. And that's actually billable services, and there is CME available. Let me see here. There's one other CareOregon resource that I want to mention, and it's for patients, and it's called Care Moms, and it is an example of integration in action. And I'm going to back up. It's not just an integration deliverable for the patients, because Care Moms is a communication tool. It's a pregnancy booklet, and it walks members through their pregnancy, and it has a highlight on oral health. The dental department did not create this. This is showing how part of this internal initiative, we had our maternal child youth program manager say, hey, we need to create this booklet. She came to me with the writers and said, guess what, Alexa, we're going to put this together. Oral health needs to have a piece in here. And I said, well, thank you. This is great. We're putting the mouth back into the body. And yes, it's not a big piece because that's not the focus of that brochure. There are certain sections during what to expect during your pregnancy, where it might say, now, make sure you followed up with the dentist, and then also guidance for how to take care of the baby's teeth, I believe is in this one as well in Care Moms. And if you are looking for additional resources, American Academy of Pediatrics, in conjunction with the CDC, created Protect Tiny Teeth. This is an online toolkit. I really like the graphic that I'm sharing there. They have infographics, brochures, examples on workflows and questionnaire templates, very similar to what I shared, and just a different perspective, different levels of questions. So this is a great resource to use as well. And then there's another one here from Oregon Perinatal Collaborative. So, and there's the screenshot, that's an example of the assessment. So with the national consensus statement having assess, advise, and then refer or navigate to dental, there is an assessment tool, family well-being, and you may be familiar with this already if you already use this, or if you have an assessment that has an oral health question, please put that in the chat box. I think that'd be fabulous to learn. Shared learning is so valuable from each other. And I love to hear where oral health is already being plugged in. So with this tool, the Family Wellbeing Assessment, they do have some oral health questions. It was created in response to integrate behavioral health, social determinants, awareness of ACEs, and then into maternity care. And there are 2 questions. I believe it's, do you have a dentist, or do you have a dental need? Or when was the last time you saw a dentist? It's around those high level, again, allowing a conversation to be had to help connect, identify that the patient has perhaps a dental need or should see the dentist, and then that next step to help connect them. And there is the workflow, the online link for that. Well, I want to thank you all for having me come here today, and I look forward to perhaps some of the questions, if you have any questions for me later in the Q&A section. And feel free to send me an email if you have any other questions. And don't forget to floss, right, Paul? Thank you.